one of the interesting things about Rachel, I think, we can grow these tumors in the lab, and we can test drugs in the lab. One of the important aspects of the study was I wanted to do a real-life clinical study. I mean, what happens in reality? And Rachel's story is reality. I mean, you live in the Ventura area. She's in an HMO. Arun had to fight to a certain degree, it was as real as it gets in your scenario, and it worked, and is working. I mean, if it can work in that situation, there's no reason it can't work. I mean, this is HMO, separate location, we get the tumor down real time. I mean, if it can work in this situation, it can work in any situation.
And that's what we're trying to achieve, is to take this company forward to the point where we can do this, or any patient anywhere across America or across the world can do this in an expeditious manner. It only takes about a little less than 2 months to establish these tumors in mice, and within 3 months you should be able to test several drugs to see if they could be useful against somebody's individual tumor.
Right. You know, I think one of the other things that comes out in your story is, historically when we take out tumors, I mean, I'm a surgeon, basically what happens is the tumor gets at UCLA or wherever, they take a piece of it and they store it in the pathology department, and it's fixed. A lot of it's fixed in something called formalin, which makes it useless for anything. Oh. At UCLA, we do freeze it so they can test genes, but basically the tumor becomes non-useful. In the community, it's just chucked, or they preserve a little bit to prove they did the surgery, but it's not useful. Yeah. That primary tumor is a source of enormous information that is completely wasted in cancer patients. The paradigm needs to be changed. And the model allows you to utilize that tumor for as long as if it grows, for as long as you want. Yeah. So Arun touched on that fact that new drugs will be coming out and they can be tested. But with the new therapies too, immunotherapies, tumor antigens can be derived from your live tumor. I mean, we bank cord blood, we bank sperm, eggs. We don't bank tumor. Yeah. We don't utilize that information, and this is the ultimate way to utilize that information because it's immortalized. So it's a tremendous opportunity that is wasted, I think, broadly, and it will take a paradigm shift for that to occur. But
there are several barriers for getting your tumor tested or grown in the mouse in the current landscape that we have in medicine, and hopefully PDX will help to erase some of those barriers, allow patients, freer access to their tissue to learn about their tumor and to test it to try to find new therapies. Yeah. And that's one of the big overarching goals of all of this.
You talked about the advocacy component of it, right? So patients are incredibly powerful. They don't realize this, but they are. I'm a surgeon. If a patient wants their tissue sent for foundation, of course I'm going to do it. You can't deny the patient the right to do that. If a patient wants a mouse model created from their tumor or an attempt, of course you're going to do it. The university is not going to say no. Right. No one's going to say no to that patient. If the patient wants it done,
it'll get done.
It'll get done.
But do you think that's more in a university or a big city setting? Like, what if you were in a small town in a rural state?
So that's where validating it comes in. So yeah, the guy can say, it's not proven, or it's too hard. But if it's proven, validated. That's what the papers are about. That's where our study coming out, showing broadly that we can do this in a real clinical scenario. Gives you patients and physicians the necessary information to make that case. And that's, so that's the interesting thing about this company, is that it's kind of backwards, really, because it's being generated, we've done the studies, are doing the studies. Normally, you create a company and they pay lots of money to do a study.
But you've already done it.
We're doing the studies. We've done all the studies. It's based on real science. And so it's a matter, it's like a company in reverse, really. I mean, companies pay millions and millions of dollars to do one study that we did in 1 year. 1 year. We completed the largest study, I don't know, 3 times as big as the one prior in 1 year. We just did it.
And yeah, these studies in the future are really going to help validate this whole process. And as it becomes validated, it's going to have wide-scale adoption across the country. And that's when, doctors in rural parts of the country are going to start using this for everyone. That's the hope, that this becomes a widespread use.